When you lose funding from the VA or from any grant for that matter, what's at stake?
To put it in the simplest, most direct terms, patients' lives. Our research is really focused on earlier diagnosis, prevention, and treatment of all cancers. And so that includes our relationship with the Veterans Hospital here in Nashville. We provide not only clinical services for our patients at the VA, but we also provide research that is literally life-saving, both in the lab and in the clinic. And even though that research takes years sometimes to translate into immediate benefit, without it, we wouldn't be where we are today, where we can cure so many more cancers that we could not 30 years ago, 20 years ago, et cetera. We've always had some cuts from the government for funding here and there, and it kind of ebbs and flows, as you can imagine, with various administrations and economies. But this degree of cuts, no, I've not witnessed this. And I've been a trainee or a student of oncology since the mid-1990s. So I think that speaks volumes for how this particular set of cuts is really going to undermine a lot of the progress that we have made. The real hard part about all of this going on right now in terms of funding being held back or being cut is that we're at such a great point in cancer research in the history of humankind. I mean, we have done things that were science fiction when I was first training in the 1990s. I got to tell you, it has been so amazing and rewarding to see the types of new therapies that have come out of research, which again included VA hospitals. All the dollars that have been spent into cancer research have not been just wasted money. It's actually led to tangible results that have cured more patients. We are one of 2 hospitals that do bone marrow transplants for cancer therapy, and we're the only one in the country that does something new called cellular therapies, or relatively new. This is the science fiction part. We can take out people's immune cells, we call them T cells. We can insert foreign genes to redirect them to a patient's cancer and give them back to the patient. And this type of therapy has cured incurable lymphomas, of which, again, we here at Vanderbilt and the Nashville VA hospital have been a part of. So this is the only VA that now offers this as an approved therapy. And so patients have to come here and we have to be there for them to cure their cancers. And that's where, the halting on research and the cuts on research are really going to affect patient lives. This is really not about politics or demographics. It's really about the care of our veterans and the future of cancer treatments through research.